Welcome to the Dental Journeys podcast, brought to you by White Coat Financial. Whether you're a new grad or a seasoned dentist, we are here to share stories of dentists from across Canada, how they got to where they are today, and the strategies that helped them along the way. Plus, we bring in experts from outside of the dental world to share insights on the business and financial side of dentistry, helping you thrive beyond the clinic. Today on the Dental Journeys podcast, we're diving into the world of intentional excellence and the pursuit of mastery in modern dentistry. Our guest is none other than Dr. Faraj Edher, prosthodontist, educator, and the visionary behind Transcend Dentistry, based in Vancouver, BC. From being the top of his class in dental school to becoming a globally respected leader in restorative and aesthetic dentistry, Dr. Edher has built a reputation around one core principle: uncompromising quality. In this episode, he opens up about the influences that shaped him and how his core values drive his philosophy of care, mentorship, and innovation. Whether you're a dentist, a student, or simply someone who values precision and purpose, you're in for a conversation that goes beyond the surface and speaks to what it really means to transcend expectations.
Yeah, if you could tell me a little bit about where you grew up, a little more about your family before you became Dr. Edher.
Yeah, I actually grew up close to here, so I am one of the few that actually grew up in downtown Vancouver. I grew up in Yaletown before Yaletown was Yaletown. Most of my childhood memories are actually in the Roundhouse Community Centre in David Lamb Park. So that's primarily where I grew up. I grew up to a family that immigrated to Canada and spent most of my childhood here, and which is why, to me, it feels really good after having a slight hiatus and leaving and getting back to be back close to downtown Vancouver where I grew up, and I live back in Yaletown now, so that's been nice too.
It's a great full circle moment then, I guess.
Yeah.
So on that note then, what made you leave for schooling?
I left to go to dental school. So as you know, with the Canadian dental system, you have to do your 4 years of sciences and then get into dentistry. So what I did is I left and went to the University of Sharjah. They follow more of an Australian dental curriculum. So it's right out of high school, doing a year of what they call foundational sciences, which is supposed to cover most of the basic sciences you need, and then doing actually 5 years of dentistry. So that's where I went to the United Arab Emirates, University of Sharjah, spent 6 years there, and then made my way back after that was done.
How was that experience being away from family?
It was good. It was actually, I was away from family for sure, but they had also, my dad had moved and he was working in the region. And so we were still close enough that I could visit during holidays and that sort of thing. But it was a great experience, like living in the United Arab Emirates and then getting to spend a lot of time in Dubai and of course in Sharjah. It was fun. It was also nice to see a different perspective on dentistry. And that was my first perspective on dentistry. And then getting to come back here to Vancouver and then do my postgraduate training at UBC and that sort of thing allowed me to also be able to compare the differences, because there are differences in how dentistry is done and the perception behind it and the protocols behind it. But it was a fun experience. I really enjoyed the 6 years I spent there.
I find that interesting because obviously dentistry, it's science and art.
Yeah.
I'm assuming the science isn't very different regardless of where you go, because biology is biology regardless of where you are. So was it more of a philosophical difference on how they viewed treatments, or what was that difference between Canadian and United Arab Emirates?
So 100%, like the fundamental science, like we read the same textbooks, we went through the same sort of scientific things, but the philosophies are a little bit different as to how to apply them. That's in some part is due to the healthcare system. It's some part due to the educational facility. So I was pretty lucky because when I was there, they had just established a dental hospital, and most patients were treated there for almost free. So we got to see a variety of different cases. There was never a question of like patient load. There were plenty of patients to be able to get experience and do different procedures on. The types of procedures that are focused on are slightly different, for example, whether it be like aesthetic versus implants. So Canadian dentistry focuses more on certain types of dentistry, whereas over there it was a little bit different. And then for me, one of the aspects that I definitely picked up from there was completely outside of dentistry, just the perspective of hospitality, particularly in Dubai, was something I was blown away by, and something that eventually I felt I wanted to bring a piece back to be able to implement in the dental world as well.
I can second that, because I remember walking through Transcend the first time. I was like, Faraj, you could fit another entire operatory right next to the one that you have. Your rooms or your operatories, I would argue, are like double the size of what they really need to be.
Actually, like double the size, because one of the big rooms is designed in a way where eventually, if we wanted to, we could put up a wall and separate it into two. But after doing this, I don't think I would ever do that, even though it's just designed for it. But it just doesn't make sense for us and what we do and the length of the procedures that we do. Having that sort of space has like significantly impacted, I think, the perception that our patients have and the comfort that they have in the environment that we've created. So it probably doesn't make sense on paper, but I think the ROI of that is greater than the ROI of adding another dental chair, which might be crazy to say, but I really believe it.
I would second that, because at the end of the day, dentistry it's not competitive in that respect, but you are a business. And while the dentistry can be relatively the same across, practitioners, it's the experience that people remember. And I think that does add to the experience. Do you ever have family members sitting in while one's in the chair, or is that something you guys don't do?
Commonly, yeah. So if they are accompanied by anyone, that's nice, because they have their own little space. A normal day for me has a 6, 7, 8 hour appointment for a patient. So doing these larger complex treatments, like if they are accompanied by someone, they can come, they can sit, they can leave, they can head back. And then also for the patient, because obviously if we have these longer appointments, we take multiple breaks. So this gives them like a sanctuary for them to have their own space, get the treatment done, and then they can go to the seating area, continue to watch a movie, have lunch, do whatever needs to be done. And it's also, for me, I find just enjoyable. Like I enjoy being in that space, as opposed to the feeling that I would get if I'm kind of crammed into a smaller room. So I can only imagine what it feels like for the patient who's in a foreign place and having to go through things that for a lot of people cause anxiety. And
having, especially if you're claustrophobic by any means, definitely having that extra space is probably a godsend. But I got carried away. Going back, I actually wanted to not fast forward, but rewind to what actually made you choose dentistry. Was it something that you knew from early on you wanted to do, or what was that decision process like?
Whenever I get asked this question, I always wish that I had a more inspiring story, but unfortunately the truth of it is, it was completely random. And I'll explain what I mean, because I was 17, turning 18 when I had to make the decision, right? Because I didn't go through the 4 years of sciences. So at the age of 17, 18, I was deciding on what it was going to be next. And I did well in school, so I had opportunities as to what I could choose to do. And I don't know if people relate to this, but I grew up in a household where there were a few professions that are considered successful. One of them being dentistry, medicine, engineering. Those were predominantly the three. And when I thought it through, what I thought I wanted to do was maybe something in healthcare. And for some reason, I thought at 17 years old that I really wanted to be a surgeon. And I remember speaking to my dad's brother, who's a medical doctor. And he was like, why are you doing this? And as I talked to him more and more, he's like, maybe look into dentistry. Because if you do dentistry and you don't have to deal with a lot of the stuff that you have to deal through going through the medical doctor programs, if you really do enjoy the surgical part, you can specialize in maxillofacial surgery or do something related to that. And I purely made my decision based off of that conversation. Like, sure, sounds good to me, let's do it. And I went in, because you do the foundational year, and from that foundational year, you choose to whether you go into medicine or dentistry. That's how the system was set up there. So in my foundation year, I decided I was going to go into dentistry and just went through that.
Okay. That's very interesting. That was one conversation.
Yeah.
Are you very close with your uncle? Was there some pull because of who he is, or was it just the career was that enticing as to what he said?
No, to be honest, I think at that stage in my life, I was quite indifferent. And I was easily swayed by whatever feedback I got, because in my mind, I very honestly was not too passionate to go one way or another. Like my passion towards what I do came at a later stage. And at that point, it was just, yeah, okay, that makes sense. I'll do that. So it was really as simple as that as to how I made the decision.
You said something that's very interesting to me. Your passion came sort of after.
Yeah.
When did you notice you started feeling a passion for dentistry and the surgery and the type of work you're doing now?
Yeah. It took something outside of dentistry for me to reframe my mind to what I was doing in dentistry to gain that passion. So what I mean by that is, as I was going through dental school, I still, I did well at it. I enjoyed it. It's not something that I ever felt negative towards, but I didn't have that, fire inside of me to want to do more in that sense. When I was in University of Sharjah in dental school, one of the things that I was and still am very proud of is I started the University of Sharjah Dental Student Association. It was the first dental student association in the university. And we grew that into what is now, I think, one of the largest dental student associations in the world. So international conferences and things like that. So that was a concept that came to me. And of course, the people that I was working with at the time, I was the founding president of that organization. And we created something that truly changed the lives of a lot of people because it changed their entire learning experience. It changed their entire experience in those 6 years when they went through dental school. And that's what planted the seed in me where I realized what I'm really truly the most passionate about in life is making a difference. That's purely what it is. And I was able to reframe how I thought of dentistry from teeth to making a difference in people's lives. And then that passion just grew towards that. So as I continued, I did this in my, I think, second year of dental school. So for the remaining 3-4 years, I had that passion inside where I was now doing dentistry as a tool for me to be able to make a difference in more people's lives. So that's how it came to be.
It's just a means. It's your vessel to do what you really want to do. Yeah. I find it interesting. So you started that dental association. Was it just you? Did you have partners? What was?
No, I was. There was myself, and then we had an entire board. So the way the association works is we have board members like a treasurer, head of community service, head of scientific committee, and we came together and we founded this organization. And I think this was in 2010. So yeah.
The reason I find it interesting is obviously you run BC Dental Study Club now. Which is really like an extension of this to a degree. What made you start BC Dental Study Club? Was it this exact same thing of I want to build a community for all of us dentists to be a part of something, to learn together, to have friendship within it, or was it something beyond that?
No, I think that's a big part of it. Like that experience to me was a great experience, and however I can replicate it in life, I probably will try to. BC's Dental Study Club started in March of 2020. So right when things happened, I was doing some speaking at that point and traveling, and it was all in person. And then in March of 2020, everyone started doing online webinars. And there were a lot of them. I think every company, every educational institute was doing online webinars, and they were pretty much open to the world. So I was one of the many people that was now at home, lots of time on my hands, attending a lot of these webinars. And what I realized is it's great because it gives access to anyone in the world to pretty much attend anything in the world, but it missed the sense of community. It wasn't me with similar, let's say, dentists or dental professionals in Vancouver, British Columbia, being able to discuss with one another challenges that are unique to our location, unique to our situations. And so that's where I started the BC Dental Study Club. It started virtually at that time to be able to bring people together within that community. At that point, we were doing it once a week because everyone was just sitting at home. Mm-hmm. And it just exponentially grew, and we continued to just develop it through our membership and what people are interested in seeing within the dental industry, and to be able to create that supportive community, but also to bring world-class continuing education to Vancouver. A lot of times people would travel to the US or even Europe or other places to be able to get a certain quality and level of education, whereas now we're trying to bring a lot of it here, and we're actually seeing people come from the US and other provinces to Vancouver to attend our study club workshops.
That's amazing. Because, a lot of people, they'll go to New York, mm-hmm. Vegas, even Toronto now, UAE. It'll be really cool to watch this grow, and hopefully people start flying into Vancouver for these events. And it's only 4 years old then. So it really is in the early stages of the club. Yeah, hats off to you for that. I guess I wanted to again rewind to, you said that you were relatively indifferent as to, the process of going through dental school and what you wanted to do, or at least to get you there. But it's interesting to me because you were indifferent to where you ended up, but you worked very hard during it. And I find that most people, they won't work hard until they know what the end looks like. But youngest, specialist in North America when you first graduated, top of your class 2014, top of your class 2017. And I would assume you had stellar grades in high school as well to get into, Sharjah. Where did that drive come from? If it wasn't, I want to become a dentist when I grow up, where did that drive come from?
I think it was probably my parents. They instilled in myself and my two brothers very early on that striving for excellence and striving to be the very best you can be at what you do is not only beneficial to your life and your family's life, but it's how you benefit your community, it's how you benefit everyone around you. And I think from a very young age, that's kind of been my driving force. Whereas I want to, if I choose to do something, I want to excel at it, or else choose something else, or don't do it at all, right? So I think that's the mentality that I've always had. So if I've made a decision that, I'm going to go into dental school, I want to be the very best at it because I've actively chosen to make that decision, and it just continued from there.
I'm so thankful for your parents to an extent right now, because not to gas you up so much, but I would argue that, your patients should be thanking your parents for that, because it's hard to find people who strive towards excellence. I find we do live in a bit of a culture of just getting by, C's, get degrees, just get to the destination and cruise from there. It's really refreshing to hear anytime you hear someone who's trying their absolute best. I feel like we don't get that much. Not in dentistry, though. I've found with the dentists I know, everyone is a perfectionist. They're always striving. So it's wonderful to see that. And I also find that no one wants to admit that they want to be the best. I think you give other people permission that, hey, you should do this in your respective industry, because that's what I'm doing in mine. Yeah. So I love that philosophy. Is that same philosophy instilled, I guess, in your siblings, in their respective fields?
I believe so. I believe so. And it also depends on how you outline what you want the best to be for yourself, right? Because that's a very personal decision and a very personal way of how you want to do things. But being the best version of what you are putting your heart and soul in every day, and more importantly, your time, which is the most valuable thing we have. I also find, I echo everything you've said, and also add to that it just, for me, and I think for a lot of people, it just makes things so much more enjoyable. When you're doing something to try to become and get the best you can be at it, it's much more enjoyable than just trying to sail through and hope for the best.
Yeah, 100%. And I guess going back to when you were at Sharjah, what made you decide to go to UBC? Was that a choice that you had made going into it, that I will end up back home? Or did it just happen to be where you ended up going to school?
That's always been my goal. My goal had always been to come back to Vancouver, and I didn't know at that time whether I would be doing a specialization or whether I would just continue to work as a general dentist. I didn't plan that far ahead. So I knew I wanted to get back to Vancouver. During my 6 years of dental school, my passion for surgery dropped and my passion for details increased. So as I was doing more and more dentistry, what I realized that I really enjoy is digging into the little details. How can you make something look just a little bit better? How can you make something fit just a little bit better? And that's where I started to realize that the best, specialty for me would be prosthodontics. Because I also get bored of very repetitive things. And luckily, prosthodontics pretty much allows you to do a wide variety of different procedures. But there's a very detailed focus on precision and technology and all that sort of stuff. So I came back, and luckily when I applied, I got into the UBC specialty program directly from dental school, which is not very common. And it just kind of made sense at that point for me to go in and do the 3 years over there and then be set up to do whatever I do next in Vancouver.
Interesting. And then after that 3 years at UBC, you were at BC Perio, correct?
Yeah.
How was your experience there coming out of school? What types of cases were you working on? really walk me through a little bit about what it was, early days of your practice.
Yeah, it was a really good experience for me. I'm very grateful for I think it was over 5 years that I spent over there. It was a great practice to start off at because of the variety of different perspectives on how to do specialized dentistry that I got to encounter. Because it's a multi-specialty office, there were different specialists ranging from, I was the youngest, but it's ranging from different generations of dentistry, and getting to understand their perspective and how they do it showed me a lot of what I enjoy, what I don't enjoy, what I want to focus on, what I maybe don't want to focus on, what I would want to do, what I would want to do less of. So being exposed to that allows you to start, because when you get out of school, whether it's dental or specialty school, you have no idea what it is that you actually want to do and how you want to do it in real life. So I feel like that allowed me to really hone in on what my list is in terms of how I want to practice dentistry. And I had the ability to do it there and learn from everyone that was there, and it was a great experience.
How many senior sort of dentists or specialists did you have to work with at the time?
I think off the top of my head, I probably got to work closely with 4 or 5 different dentists over the 5 years that I was there. Yeah, just getting to discuss cases with them, see how they do things, get their input on things, share things with them, that sort of thing.
Interesting. And with respect to the cases that you were working on early on, were a lot of them cosmetic in nature, or is that something that kind of became more and more part of your practice as you matured in the career?
It was intentionally increased over time, I realized, because initially when you're right out, your primary focus is trying to get busier and you're trying to pretty much do everything. And that's when I realized early on in the process that I don't want to do that. And that was a difficult decision to make at the time, because again, you're trying to get busy, you're trying to get more experience, you're trying to learn more. But what I realized is you're kind of setting yourself to enter a race that would be very hard to get out of if you start to take on everything, because you start to, first of all, build your reputation based off that. It definitely affects your skill set as you do more or less of certain things. And one of the things that I did, which probably made it slower for me to actually get to the stage that I wanted to be in terms of productivity and busyness, it lengthened that time frame, because I started to say no a lot more to what I would and wouldn't do, and take on the types of cases that I did want to do. And aesthetic cases are something that I very much enjoy. Full mouth reconstructions are things that I very much enjoy. And it also allowed me to hone in on that mindset, which is I want to become the very best I can be at the things that I do. And I want to be able to hand my patients over to other practitioners that are the very best at what they do. I will never be the best at everything, and I'd rather they get the very best care. If that means that I send them somewhere else, then by all means, and eventually I'll be able to build the practice that I want to build, doing the things that I enjoy doing and the things that I feel like I'm the best at doing.
Have you found that the more you've specialized, the more iterations there are of a very particular thing? Because I've personally found that in my life. As I've got narrower and narrower in who I help and the type of work that I do, it was almost, the best way I can explain it is, I don't know if you ever remember in, even in high school, when you had to write a paper and the teacher said, pick any topic you want. It was so hard to pick a topic, but when they gave you a very specific topic, you realized how many subtopics that you could actually cover within that thing. Have you found that same thing happening in your practice now, where you're getting tighter and tighter on what you're working on, but the iterations and the different ways to do that procedure are increasing?
For sure, yeah. As you dig deeper in something, you learn more about what you didn't know. And I think the deeper and deeper you get into a subtopic or a subspecialty, the more you realize how little you know. And to me, that's exciting. To me, that's something that's actually enjoyable, where it's like, okay, this is never going to get boring, because I'm always going to have more that I can add, more that I can improve, more that I can implement. And it's something that I always recommend to people in the profession, especially starting off earlier, which is initially do everything, because that's how you taste what you enjoy and what you don't enjoy. But then once you figure it out, that's probably the most important question to answer. Like, what do I want things to look like for myself in the future? Once you're able to answer that question, then commit to that. And it'll be a little bit more of a grind and a struggle, but it'll be worth it because you're building up for hopefully a long career. And if it takes an extra year or two to get there, it's worth it because then you set the rest of it up for something you enjoy.
There's a saying, I think it's by Stephen Covey, where instead of climbing the ladder, make sure it's up against the right wall first.
Yeah,
and I think that's exactly what you just said. Fast forwarding, I guess, sort of to today, before Transcend and all of that, you started doing a lot of cosmetic cases. How did you deal with communicating or setting the right expectations with those cosmetic cases? Because I've noticed just from anecdotal sort of what I've been told is I feel like that makes or breaks the treatment of setting the right expectations. And then, with the end product, how do you communicate that uncertainty to a patient when they're sitting in front of you and they're already feeling very anxious? Because I feel like dentistry, that's the other side of it, is the communication with patient. Was that something you picked up on very early, or how do you walk through those conversations today?
That's a really good question because it depends on if we're focusing on just the aesthetic, if that's all we're kind of talking about at this point. For me, the thing that helped with that was understanding initially that aesthetics is subjective, which means that there's no way for me to predict whether someone will like the aesthetic or not based on my subjective opinion. And that was a switch that I had to make that I think really improved in this situation, where I'm not trying to dictate my subjective aesthetic opinion on you. My goal is to use my experience and my understanding and skill sets to be able to understand as best as possible what it is that you want to see, and then let you know whether, first of all, I think it's a good idea or not, and then second of all, if it's doable or not. So that's how I focus on that aesthetic conversation. It's not so, well, here's what I can do. It's more so, what are you looking for? So you set the standard for our conversation moving forward, and then I'll give you my input. First of all, I'll tell you maybe you think you want the whitest teeth that exist in the world, but you're probably going to regret that if we actually do it. Or I'll tell you, well, that's not even possible in the reality of things. So that's how I view that conversation. It's more so from the patient side, and then I'm kind of the person that is reviewing that with them and providing my input and not vice versa. And then the second aspect to it is, I think a lot of my patients, because I've been doing this now for a few years, and they've been able to see some of the work that I've done, you attract people that agree with your aesthetic and what you kind of like. Because it's similar to, for example, if you're looking for an interior designer, right? You want someone that somehow aligns with what you think looks good. Because people find different things differently, right? I might think something looks beautiful, whereas someone would look at it and be like, that's not my cup of tea. And I found that to be the same as well, and it goes back to what I was saying, which is being comfortable saying no. Because if someone does want a specific outcome and I'm not the best person because I don't believe in it, I wouldn't be, let's say, proud to say I created that smile. That's perfectly fine. It doesn't mean that my subjective opinion of beauty is right and theirs is wrong. It just means that we're not a good fit to be able to do it, because I want to be proud of what I give them, and I want them to be extremely happy with the outcomes that they get as well. But I think your question's a very important question, because setting expectations is very important in the sense that that's where I would say, especially with aesthetic cases, most of the complications come in. It's not necessarily bad outcomes, it's bad communication as to what the outcomes will be.
Yeah, that uncertainty and trying to work through it, because this is a terrible example, but I feel like, I don't know if you or anyone who will be listening to this has ever done a renovation, but in like a house, there's this thing that as soon as you take down a wall, you don't know what's on the other side of that.
Right.
And you could, open up a wall and think, your timeline for the project is 6 weeks and you're going to do whatever it is. But then you open up the wall and there's asbestos in it, and now the entire project's going to take 6 months to get a remediation team in there. is are aesthetic cases a little bit like that? Because once you really start opening things up, of course you can do the scans and all of that, but then how do you communicate that uncertainty of, hey, when I do this certain thing, I don't know what the outcome is going to be, especially on an aesthetic case. How is communicating that with a patient, or even personally as the doctor, how is that on your end, like mentally of like, okay, I'm going to work on this, but I don't know what it's actually going to turn out to look like.
Yeah. There's certain tools we can use to give ourselves or give the patient the most educated guess as to what we expect. Just like I'm sure you can scan a wall and see what's behind it. I'm sure there's some things you can do that way. Similarly, we can take radiographs. If we're hesitant about a certain design, showing them a rendering of what the future smile could look like, get the input. So there are certain things we can do to minimize the chance of there being that sort of discrepancy. In aesthetic cases, normally, if you do your due diligence and good diagnostics, it's rare that there's a surprise, because normally with aesthetics, you're working on relatively healthy teeth. But that what you're saying happens quite often when we're doing like reconstructions, opening up bites, working on teeth that are maybe more heavily restored or heavily worn down. And in those situations, I'm just very transparent in communication with patients, where I let them know exactly what you're saying. I can give you an educated guess on what's going to happen, but we only really know definitively once we're in there. And here are some of the bigger picture options of what can happen. Are you okay with that? If yes, then of course I'll keep you updated every step of the way, and it'll be an ongoing conversation. Which is why building that sort of trust in the process is very important with patients. They have to trust the process. They have to trust that we have their best interest at heart, and every step of the way, regardless of what we find, I might change the plan. And that's maybe something that causes more anxiety for patients, I'm sure. But at the same time, if you really think about it, it should cause less anxiety. What you would want less than someone changing the plan is someone sticking to the wrong plan once they know that it's no longer the best plan, right? Yeah. I'd rather someone tell me we have to change the plan than for them to try to force what we talked about just to avoid that conversation.
I've never thought about it that way. That is true. Yeah, you'd rather have someone change course or have the humility to change course rather than force it due to just simply ego or not being able to have that tough conversation. Yeah. It's a very good point you make. And I guess similar to that same line of thought here is that I've noticed obviously a theme of excellence and perfection in terms of your work. And perfection is this obviously elusive thing. It doesn't technically exist, but I feel like in dentistry, in aesthetic cases, you kind of are aiming for perfection to an extent. How do you balance that chase with the fundamental reality of, things aren't going to be perfect? We could do all the planning. I could do my job perfectly or execute it to the full degree, and it might not end up perfect. Yeah. How do you balance that, that reality versus the chase?
I think the way you phrased that question is the best way to explain the answer, which is just fundamentally understanding the reality of what it means to aim for perfection, as opposed to actually realistically expecting perfection, are two very different things. I aim for perfection and pursue perfection every single time I'm doing something, but I fully understand that I will never achieve perfection. But what aiming and striving for perfection will allow me to do is I will land somewhere much closer than I would have if I was aiming for mediocre or standard of care or average. And the other aspect of it is, to me personally, I enjoy the process of learning and improving. So very commonly, I'll, for example, go through a reconstruction or a smile makeover for a patient, and they'll be thrilled, they'll be happy, they'll be crying of happiness from that change, and I'll love it too. But then when I take a look at the photos, I'll always find things, and that's the process that I enjoy, where it's like, yeah, but that could have been slightly different, and that's why hopefully I'm improving, with each case, with each situation that I run into. And that process for me is a very enjoyable process. It's not in any way discouraging, but rather encouraging that, we got great outcomes because we did everything as we thought we should. but here's how I'm going to do it even better next time, and better next time, and better the time after.
For anyone who's obviously going to be listening to this, they're not going to see that I was smiling when you were saying that, because I found it very interesting that you were saying, I almost knew that you were going to say this, with the person's crying, they're so happy, but you found the flaw in it, because there was this tiny little thing that they probably didn't even notice, but you sort of turned it on me, because I thought you were going to say it bugs you and whatever, but you were like, I enjoy that process. It's a very healthy response, because, and again, I don't want to paint with a broad brush here, but amongst dentistry specifically, and anyone doing any form of surgery, there is this pursuit of perfection and a standard of perfection. And if you don't achieve it, or you're not satisfied with it, there is usually, a darker side to that can go and honestly bleed into other areas of your life that maybe, things aren't going to be perfect, like relationships and whatnot. How have you gotten to this healthy state? Is this something that, you were born with? Or have you actually worked on having this mindset towards striving, but not having the expectation of perfection? Because you sound happy about this process, and I don't hear it often.
It's a great question, because I've never, I think, even explored this in my own mind as to why I think of it this way. But just thinking out loud with you here, I fundamentally, I think, enjoy challenges. Because the way that at least my mind is wired, and it's probably a very deeper, like I'd have to dig much deeper to know why, but the way that my mind is wired is every challenge that comes up, the harder the challenge to overcome, the further along I am. And you hear this in sports, and you hear this in a lot of things, where it's like the harder the challenge, that's where a lot of people will stop. That's where a lot of people will back off. And to me, I view it as an opportunity. Okay, well, to get to the next level, this is kind of the challenge that I now have to overcome. And I think of mistakes or improvements in that sense as well, where it's like, okay, well, to get better, now I have to address this and move on to the next part. So to me, it's kind of like a video game that I think of, and it's like levels, and with each level, you have to beat the person that comes at the end, and those are the little challenges in life that we come across, whether it's in the clinical dentistry or running a business or even personally. It's the same thing.
It's almost gamifying it a little bit.
Yeah. And enjoying the process. And this is something that I think, again, was instilled in me in my parents, where they have always taught me from a very young age, like, we only focus on the process. We never care about the outcome, because the outcome is not necessarily in our control. What is in our control is everything we do leading up to the outcome. So they used to say this when we would study for exams in school, because they'd be quite hard on us, like, study, and you have to do this, and you have to do that, and you have to get good grades. And then, an hour before the exam, you're anxious. And I remember they would come and say, at this point, relax. You've done what you had to do. That's the part that you can control. What now comes after that is out of your control. So just relax and enjoy that you've put in what you needed to put in during the process.
I like your parents.
Yeah, I like them too.
They sound like good parents. Yeah, it's nice that they gave you that permission of work hard, but it's okay to fail. It's okay to not, get the expectation or the result you like. I guess maybe that, thinking back to my own question, maybe, that's where some of that, the contentment with not having the perfect result maybe comes from. Because you're like, oh, I've done the work. Yeah, the result is a little out of my hands. What
would really bother me is if the results weren't where I needed them to be or wanted them to be, or if I noticed even the tiniest flaw and knew that there was something on my part that I could have done better. That I would never be okay with. That I would probably lose sleep over. So I think it is exactly that. It's knowing, well, I've done everything I possibly know I could do, and I hold myself to a very high standard. So it's not that I'm just saying that to make myself feel better. So the outcome is now what it is, and we go from there.
Interesting. So I guess you did your time at BC Perio. When did you decide that you wanted to start your own clinic? And what was that process of, leaving BC Perio to starting Transcend Dentistry?
It was in 2020 that I started to seriously think about it and plan for it. And the reason being is I felt like, again, I was at a point in my career where I really knew how I wanted to practice dentistry. I really knew what I enjoyed doing. I knew what I was good at. And I was starting to also see that I was getting a lot of patients referred to me or that come out and see me from different cities, different provinces, sometimes different countries. And what I wanted to do was create a space that resembles the things that I stand for in my clinical dentistry. So that's where Transcend came to life. It was, this is how I do clinical dentistry. This is how I do the procedures. This is how I care for my patients. I now want to actually create an environment that stands behind those same values. And that's why our slogan is uncompromising quality, because that really distills it all into two words: uncompromising quality of dental care, uncompromising quality of environment, uncompromising quality of the technology and materials that are used, uncompromising quality of the experience that you get. So being able to have that all under one roof was the entire kind of vision behind putting Transcend together.
Interesting. I kind of already know the answer to this question, and I'm probably already going to agree with you, but I'm going to ask it anyways for anyone who's listening, because at the end of the day, you are a business owner. Yes, you're a prosthodontist, you're a dentist, you're a healthcare provider, but you're also a business owner now. Have you ever had the sway of, I could cut a corner in this spot, no one's going to notice it, the end result will likely still be the same, but my bottom line will be a little bit better? A little bit like, have you ever heard the Steve Jobs story where he was talking about his father, who was, I believe, was a carpenter, and he would actually finish and like sand down the back of the cabinets.
Oh, really?
They're on the wall. No one's going to see them until you pull them off, but he would do that. And you could cut a corner in that kind of aspect, and no one will know, and it'll improve your bottom line. Have you ever felt a sway to do something like that? As a business owner, with the loans, starting a family, getting married, being young, out of school, like, I want to make some money. But balancing that.
Every day. There's things that come across every day where you have to have that equation played out in your mind. Interestingly, as you were saying that, I was thinking in my head, that's something that we do on a day-to-day basis in the patient's mouth when we're treating them on the spot. And I think that's honestly a big part of what differentiates excellent quality versus, let's say, standard of care. It's, you know that you could do just a little more here to make this fit just a little bit better. Are you going to spend that extra 5 minutes, or is it good enough, right? So I feel like that goes back to just your philosophy as to where you want to draw the line. From a business perspective, though, when setting up Transcend, this was a very common thing, because you're choosing everything, right? You're choosing the size of the room, you're choosing the finishes, you're choosing the technology, you're choosing all of that. And I had to constantly think about that aspect of things, because I also want to be practical and realistic from a financial sense. And to me, I came up with a question, and I would just ask myself this one question to be able to make a decision as to, is this something that I could cut a corner on, or is this something that I can't cut a corner on? And that question was always, does this in any way affect the quality of care and the quality of experience that my patients will have at Transcend? And if the answer to that was ever yes, then cutting corners was not an option. That was something we're going to go full out on, no matter what the cost or time or effort is, because at the end of the day, that's what we're creating. That's the entire purpose of what we're doing. That's our brand, that's our ethos, that's our value. If the answer was no, this won't actually affect the quality of care or experience for my patients, then I'm going to be a little smart about that decision and try to figure out what makes the most sense.
I like that. That's a really good way of framing it. And I guess along the same sort of line of questioning, you already have this philosophy amongst yourself, and it's your standard of how you do things, and it was bred into you by your parents, it sounds like, and you've been this way your entire life. Because if we track back your story, there is this uncompromising quality, or at least dedication. How did you instill that in your team? Because they don't own Transcend, they don't care about the bottom line. As a clinic owner, how do you pass on that culture to everyone that comes in and make sure that they don't cut any corners with patients?
By not tolerating anything less than that. Okay. To me, what I learned very quickly is that's the answer. It's, first of all, being very proud of what we're doing and expressing that to the world. because then you attract people that want to be a part of that same philosophy. And if you end up making the wrong decision, which means that you introduce someone to the team that does not already have some of those core values instilled in them, by not tolerating it and either encouraging change and seeing change, or switching them with someone else that might be a better fit for the team. And to me, that's, I think, the most practical way to do this, because when I think of our team, I think we're extremely lucky because we have the best team in terms of being able to have us aligned on that value of things. And we were actually talking about this, I think, a couple weeks ago, where I was saying it's very interesting for me and really nice to see how different we are as people. Like, our team is so different in terms of our personal interests, our family lives, our backgrounds. All of that is extremely different. Yet how we all have come together very, very aligned on what we're trying to do, which is be the very best we can at the things that we choose to do every single day. And that's made it very easy. I found it to be very honest, and I say this knowing that it's not easy, but it's made it very easy for me to be able to add to our team when we need to add to our team with people that are very keen on being a part of this, because they get a lot of value from it. They know that we're going to get a lot of value from it, and it's something that we get to experience together and grow together and be able to fulfill one another through that.
Yeah. There's this culture that is instilled just by being yourself, I guess. I remember hearing this from, it was a mentor of mine, and we were talking a little bit about, when I was first starting my business, and so like, I want to do things this way. And I think I've even mentioned this maybe to you, but it's someone else, but I said something along the lines of like, I'm either very right or I'm very wrong. Because I wanted to do things that no one else in the industry was really doing, a certain model of how I run the practice. But I found decisions like that. What my mentor said to me, where I was going with this, is he said that no matter what instrument you play or what your style is, there'll always be an audience for you. There's 8 billion people in the world. And it seems like you've curated an audience for yourself, not just with your patients, but also with your staff. How important has it been for you to just, how important has no been for you? Because it's come up, no, the word no. You've said it multiple times, and it's clicking as I'm working through this. You said no to certain treatments. You've said no to certain styles of practice. You said no to cutting certain corners. How important is that in your professional life and personal life? And where do you get the courage to say no? Because it's scary to say no.
Very important. To answer the first part, and where you get the courage is by understanding that it does everyone a favor. When you, at least that's how I view it, where it's, if you ask me to come and give a presentation, and I know that I really don't have the time or desire or passion to do it, it's more fair to you for me to be like, nope, I'm not your guy, because I know I'm not going to give 100% to it, than for me to just say yes because I don't want to say no. The exact same thing applies to when choosing team members. If someone isn't aligned with your core values, they're not going to have a good time there. They're going to be under constant pressure, because that's not, where they want to be in terms of how they do things. They're probably going to be under a lot of unhealthy stress. So saying no actually does the other person a favor too. And getting the strength to do that is by, I think, really believing in why you're doing what you're doing. And I've gone through this myself, where I've made decisions knowing that we would end up being short-staffed, and I would prefer for us to all be under pressure for maybe a few weeks, knowing that we've let someone go that we don't have an immediate replacement for, than for us to tolerate a certain work ethic, let's say, that is not aligned fully with what we're trying to do. And believing in the fact of what you mentioned, and you described it perfectly, which is that whatever it is that you're doing, you're going to attract people that also believe in it and want to be a part of it as well. It's just a matter of time, and it's just a matter of finding the right person. So having that belief where it's like, I will get the right person, but I have to be able to make the tough decisions to allow that to happen.
You've been running Transcend for a year now, a little bit over a year, so congratulations on that. 1 year under your belt, in hindsight, what's the most difficult part of being a clinic owner? And then on the back end of that, what's the best part of running your own clinic?
I'd say the most difficult part has been time, like just time management and being able to do everything that needs to be done. That's I think the part that has been the most challenging on my end, especially considering all of the other things I do and now adding to them a lot of the operational admin aspects of Transcend as well, finding the time to do it all. The thing that I've enjoyed the most has been truly feeling that on a day-to-day basis, I really love going to work. I really enjoy being there because it's something that aligns fully with how I want to do things, and knowing that hopefully I'm not deceiving myself, but that everyone there is also enjoying being there too, because we all align on being able to do that. So that to me is what brings me the most joy. It's having that ability to create a space where we're all aligned and we all enjoy dedicating our time to be able to develop this.
Yeah. You mentioned obviously juggling multiple hats, and I think that's just the nature of running a business. It's kind of what you sign up for. One thing that you haven't necessarily signed up for, it's not part of the business, is the speaking and the teaching and the education side of things. You know, at UBC, you do talks at PDC, you run the study club. What made you decide to, maybe not decide to start, because the BC Dental Study Club started around the same time as Transcend. What makes you continue to do that? The teaching, the speaking, the education side of things, the BC Dental Study Club. What's the driving force behind that?
Yeah, when I said that making a difference is my passion, if I were to say what's my passion, it's making a difference. I think that education is one of, if not the best way to make a difference in the world, because it allows for exponential difference to be made. Because when I'm in a room adding just a little bit of knowledge to a group of even 10 people, over time, those 10 people are going to pass it on to other people. So when I think of making a difference, education is truly creating exponential waves of difference that's way past just what I'm able to do with my own two hands or with my time.
Mm-hmm. Yeah, because there's only so many patients that you could see.
Exactly.
But if you could teach someone something you've learned, they can now pass that on. You know?
Yeah.
I like that answer. I guess we've talked a lot about your past and what's gotten you sort of here. What's next for you? Where do you see, let's say, the BC Dental Study Club going? Where do you see Transcend going? What's next for you professionally?
Yeah, for Transcend, what I envision for Transcend is for us to be a multi-specialty dental practice that holds multiple specialties and all under the umbrella of uncompromising quality. So for us to be able to be that place that supports the dental community, that supports our referring offices, our referring dentists, that supports our patients, knowing that we can provide truly interdisciplinary care, which is the best kind of dental care you can get, under one roof, with that motivational or drive of everyone there being, we want to do things to a level that is uncompromising in quality. And then from a BC Dental Study Club perspective, it's really just continuing to grow our network, grow our community, be able to add more value to the community in every way we can. Being able to, as we were saying, continue to develop the BC Dental Study Club to attract dental professionals from all across the country who want to be a part of our educational events, and to be able to bring it locally here to British Columbia. And to me, the best part of the Dental Study Club has been, you've been to our gala dinner, and that to me is the best part of the study club. It's that sense of community, getting to see people and support each other and learn together. And it just makes everything we do, I think, so much more enjoyable to have that, as opposed to, like you said, dentistry is getting competitive, right? But we're not really competing against each other. And I don't think we need to have that feeling either of us being competitive against each other. It's more so supporting each other so we all do the best we can.
Yeah. I also found that while I was there, it was nice to see even some of the guests that I had come with. They hadn't seen someone, you know, you go off to specialty school, you come back and you're like, oh, I haven't seen you since we were, 21 years old, and now we're in the same room together. I loved seeing that aspect of bringing that community together, because social media is great, everyone connects on there, but really seeing someone in the flesh is just that much better. And the event was amazing. I'll be honest, I was shocked by like some of the stuff that you guys are showing me, because to me, obviously I work with dentists, I see the work that you guys do, but to see some of the procedures that you had worked on, to me it just looked like magic to an extent. It looked like alchemy, because you take this, you know, bad situation, someone needs like a full mouth reconstruction or whatever it was, and then at the end of it, you know, you completely change their smile, their life to an extent. So it was cool for me to see that at the event. And I think everyone in the crowd honestly felt the same way, because you're all looking at this going, yeah, this is what we do. We you know, change people's lives to an extent through the work that we do. So I think you've definitely accomplished that aspect of creating a community through BC Dental Study Club.
Thank you.
Yeah. I guess the last way I wanted to sort of wrap this up is Ricky and I are still working on setting up like a standard 3. We both have separate ones, but I like asking all of our, you know, guests who are coming on a standard 3 questions, because I think it says a lot about them. And I think everyone would want to know these kind of things. But my first question for you is, what's the best piece of advice you've ever been given?
Well, I've already shared with you the one from my parents, which is that you focus on the process and not the outcome. That was very impactful, I think, in my life. But then the other one that comes to mind is from a mentor of mine. His name's Professor Richard Simonson. And he once told me, the harder you work, the luckier you get. And that was very impactful for me as well, in the sense that, again, it almost kind of coincides with what I was talking about with my parents, because you can't really focus on the outcome, again, whether we're lucky or not. What you can focus on is what you can control, which is working hard. And so I've really liked that advice, where the harder you work, the luckier you get.
Yeah. You see it in your own life and how it's done, especially with your parents. Yeah, the harder you work, the quote unquote luckier you're going to get on that exam or whatever it is.
Exactly.
I guess my next question was actually going to be if there's a quote that you live by, but you've sort of already discussed it, which is uncompromising quality. But would you say that's the one that's sort of the mantra or the quote that you live by, or is there something else in there?
Maybe on a professional and somewhat personal level. The other one that comes to mind is a philosophically deeper quote. I don't know if you want me to get into it, and it's a longer one. Can I bring it up?
Yeah,
because I don't even have it memorized.
I would love it. Yeah, let's hear it.
It's from a book called 40 Rules of Love. I don't know if you've ever come across it, but it's a really great book. I definitely got a lot out of it. And okay, so the quote is, "It's never too late to ask yourself, am I ready to change the life I am living? Am I ready to change within? Even if a single day in your life is the same as the day before, it surely is a pity. At every moment and with each new breath, one should be renewed and renewed again. There is only one way to be born into a new life, to die before death." And that's something that when I read and delved into trying to understand it, for me, it's been very impactful in my life, which is that, you know, one of my inspirations in life is to constantly redevelop myself as I live through life and not end up being stuck the same person for a long period of time. And so that quote of like, to truly be born into a new life is to die before death, is you have to constantly do that internally and redevelop yourself and be okay of letting go of big parts of who you were to create space for you to become the person you now want to be, and that changes over time.
Mm-hmm. It takes a lot, I feel like, to do that. We sort of touched on it with respect to, like, if we were to tie this back to the professional side and dentistry, to be able to have a plan, you know, you tell your patient, this is how we're going to do things, and then to be able to change plans is a little bit of what you just said, this ego death to an extent.
Yeah, exactly.
Right?
Yeah.
Of, I said I was going to do this, but we're actually going to change directions because, you know, things are different. Mm-hmm. How have you, if you don't have to share this, but how have you applied that to your personal life? Because I feel like we've heard how you've done that professionally, but personally, is there any examples that you don't mind giving, or?
Sure, yeah. I think on a personal level, what that's allowed me to do is be very receptive to changing my mind, even regarding deep core, things that you think are deep core fundamentals as to who you are. And having the willingness to question those things a lot of times is what allows you to unlock a new person that you may want to become. So that's how I apply it on a personal level, where like I'm a big fan of philosophy, and this ties into that because philosophy, a big part is like those core fundamental things that you believe in. And a lot of people live their entire lives not willing to let go of certain aspects of that foundation, some of which you might not and maybe shouldn't let go of. It doesn't mean that you have to change all your core values all the time. But if you come across something that maybe will allow you to be a better person, having the humbleness, like you said, to say, okay, well, maybe I should let go of that part of me and allow myself to become the person that I now want to be.
I feel that's great advice. It takes a lot, though. It's something that you actually have to work through, and no one's going to be perfect with it. Even myself, I find the same things in life and be like, well, I used to think this way, but new information has been presented, and I have to go back on this, or I don't believe that same way. But on the flip side, there are certain things that I think we shouldn't change on.
That's true.
Absolutely. Next question was, what's something that you've done that you recommend everyone do? This could be an experience. This could be anything.
The first thing that popped in my mind was skydiving, but I'll put that aside and say something more useful. I think one of the things, when I was doing that Dental Student Association, one of the things we really focused on was community service and volunteering. And one of the experiences that I had that I think was very eye-opening to me was volunteering at senior homes and just spending time with people at that stage in their life, just having conversations and really seeing, when you get to that point in life, what really matters, what you actually care about, what you actually remember, and getting that sort of wisdom and perspective on what the true value of life is for most people when they know that they don't have as much of life coming than they had before. So
I never thought about that. Yeah, that would be an amazing place to spend your time. Maybe it'd be a little bit better than a hospital because it's not as heavy. I actually volunteered at an old person's home, but I couldn't do it. I spent about one day there volunteering. It was too sad for me. I couldn't do it. But I never thought about it in that respect, that you get to learn from these people who've, just so much more experience than you in life, and from all walks of life. And what does the end look like? Skydiving would be a lot more fun, though, I'll be honest.
Probably true.
I was going to say that the last question that I actually had before, as we sort of wrap up, is what advice do you have to your fellow dentists out there, whether they're, early career or someone who's, further along the line?
I think the most important piece of advice I have when I speak to people starting off in their career is figure out how you want to do things and then resist all temptation to compromise on that. Because there's a lot of temptation that comes in for you to just fall into what is mainstream and the norm. But being able to really identify how you want to do things and then stick to it is, like we said, a little harder of a path, but I think it's just so much more worth it in the end. And setting your own standard for what quality of care should be. Let me rephrase that. Setting your own standard of what quality of care should be, making sure that it's above the standard of care, right? But that's something that I'm very passionate about, which is, we have a standard of care and there's a good reason as to why we have it. And luckily in Canada, we have an excellent standard of care. That's the truth of it if you compare it to it anywhere else in the world. But that does not mean that the standard of care should be the maximum we strive for. The standard of care should be the minimum we accept. And there should be an unlimited potential of what you get to beyond that.
I think that is a perfect place to end it because I feel like it summarizes everything that you have been saying. So I know you have to get going to go see a patient. So thank you, honestly, for taking the time.
This was a pleasure. Thank you. This was really fun.
I really appreciate you taking the time. This was. I think everyone will get something out of this conversation, whether they own a clinic, they're a brand new grad, or if they've been practicing dentistry for 20 years. So I appreciate you once again.
Thank you.
And there you have it. Insightful, authentic, and deeply inspiring words from Dr. Faraj Edher. If you'd like to connect or learn more about his work, you can follow Dr. Edher on Instagram at Dr. Faraj Edher. You can find his clinic and YouTube by searching Transcend Dentistry. And to join this thriving dental professional community, You can find the BC Dental Study Club at bcdentalstudyclub.ca. Thank you for tuning in to the Dental Journeys podcast, and until next time, keep striving for excellence. The content presented in this podcast is for informational purposes only and should not be considered personalized financial, investment, tax, legal, dental, or any other professional advice. Opinions expressed by the hosts or the guests are personal and do not represent the views of any affiliated organizations, employers, or professional bodies. Listeners are encouraged to consult directly with qualified professionals regarding their specific circumstances.